Welcome, Khirsty MacArthur, who
Thank you, Heather.
in now, my understanding, 30 years at BC Children's and Women's
Yeah.
Regional Health Center.
Casting my mind back, it has actually been 30 years, and it's just been an amazing professional journey for me, filled with lots of learning and growth and opportunities. So I think that's probably what's kept me in nursing for 30 years, is that I've been able to step into a lot of different roles within nursing. And I think I always say to new students and new nurses coming into the organization that you can really challenge and grow in your nursing career by just getting curious and exploring what's available to you and stepping into new and different roles to keep nursing interesting and engaging, and also just to keep learning. I think we talk about in our organization lifelong learning, and I think that's really where I think that's the best perspective to choose when you're in nursing, is just to be open to learning and growth and new opportunities, new ways of nursing. So I would always encourage new nurses to just have an open mind, and if you want to be successful in a different area in nursing, then I would just say pursue it. Keep it fresh, and keep, as I said, an open mind to what's available to you in nursing. So yeah, 30 years is over half of my life. So I've given a lot to nursing, and it's been
started out, you worked on pediatric floors as an actual clinician. And then you moved on to becoming a clinical educator. And now you're in leadership in the Learning and Development Department at BC Children's as part of the administrative senior leadership. Can you share about that, what that entails?
Well, I think each of the steps in my nursing career prepared me for ultimately where I think I wanted to be, was in education and nursing. I loved working at the bedside, and I also knew that there was more for me. And because of my love for learning, I decided to pursue the direction of education and nursing. So I went from bedside for about 5 years, and then I stepped into a clinical education role, which was supporting nurses at the bedside and within the specialty area that I was working in, which was cardiac respiratory. And then I moved to an infectious disease program. And then I was a head nurse for a little while. And so all that experience sort of prepared me to be able to step into a role in education, because I had experience in all those different roles. And I brought that skill set with me to the education role. And it actually helped me to understand what it really is like at the bedside, and what are some of the current challenges. So currently at my role, I support an employed student nurse program. So students come and work in our hospital to gain experience. And I also coordinate a preceptor program. So all the new nurses coming into the organization are paired with a preceptor, and that preceptor supports them in their learning when they first enter the profession as a new grad, and helps them to build competencies in order to provide safe, best care when they're finished their preceptorship. And then I also coordinate a mentor program, which is when new nurses are finished their preceptorship, oftentimes it can be a little bit challenging. There's a lot of research out there on new grad transitions, and sometimes the sort of after you finish that initial training, it can be, you can feel a little bit isolated, and there's some challenges in feeling like you maybe aren't ready, or it's overwhelming to work as a new nurse. So we like to pair the new nurses with a mentor, and that mentor will support them with that, with the ongoing transition into the unit, to become part of the team, to socialize, to understand the culture of the workplace better. And so that mentorship relationship can last up to a year. And so what we know from new grads is that's a really helpful support for them to be able to feel grounded in the work that they do and feel more certain and competent in their role.
BC Children's and Women's is a regional health center. Yeah, so can you speak to a little bit about the organization you work for, the quality measures that you conduct?
Yeah, we are what we call a tertiary center. So we see children from all over the province in British Columbia, and the children are usually the most complex and acute patients. So they come either as inpatients, and we see thousands of patients every year on an outpatient basis. And those are the kids that access our healthcare because we are so specialized. So I'm guessing that there's probably a hospital in Washington that's similar. And so the complexity and the chronicity that some of our children's and youth have are present unique challenges. So I think those unique challenges call us to be practicing in a way that is evidence-based. And so I would say that in terms of providing best quality care, we really look towards the evidence. We look to what are the best practices for kids with chronic and acute illness and complexity. So that's our work every day, is to look at our practice and really understand, is there something better we can be doing? So we do what we call benchmarking, and we look outside of our hospital and we see what are the best practices in pediatrics for certain diseases or certain specialty areas. Are we doing that, and how do we measure that? How do we know that we're practicing according to what the science and evidence says about pediatrics? So we do lots of testing. The process that we usually go to when we're measuring our quality of care is we ask the questions: what are we currently doing? What do we need to explore? We look at the statistics. We look at surveys on patient satisfaction. We look at patient outcomes, and so we ask those questions: Are we practicing according to what the science says in pediatrics? And then we try to give measure. We try to look at efficiencies. Are we being as efficient as we can? Are the patients satisfied? Are they getting the care they need? Are they having to come back to hospital? How often? How many patient visits are we having? So we collect all that data to ensure that we're providing the best quality care that we can for children and youth within our organization. I think what we know about patient outcomes is when we give measure to what we're doing, and that's looking at the data, and what we know about patients and families is if they have a positive experience in hospital, then their outcomes are going to be better. And so what we really want to aim for is that how do we meet the needs of our patients and families in a way that helps them to be successful when they leave the hospital. So we actually have a patient experience team that supports us to provide best care in terms of not just the nursing and medical care, but their care to help them feel safe and to help them feel connected and to have a voice in their care. And what we know about that is if that all happens, then they're more likely to heal, be well, and stay out of hospital. So that's been a fairly new initiative within our organization, where if we can support them psychosocially, and that's really things like introducing yourself when you go in the room so they know who's caring for them, providing them opportunities for choice, supporting them with some of those comfort measures that we don't necessarily think about in those really busy times, but spending those extra minutes with them, we know that makes a difference to the outcomes that they're going to have in terms of their health and healing. So so there's just a few things that we've done. Lots of we have a quality control, quality and assurance department that measures things like hand hygiene. Are we meeting the targets for nurses washing their hands every day? So they give measure to that, and they report back to us, so we know, are we actually providing safe care? And if we're not, what are some of the interventions that we can put in place?
I'm wondering if you can share a couple of projects which impacted the quality improvement of the health system at BC Children's and Women's, and how you implemented it, and what were some of the outcomes that you experienced.
Mm-hmm. Sure. I think one of the bigger ones that we implemented at our organization was supporting people to learn a model of communication that integrated coaching skills. And some of the coaching skills that we use within the coaching model that we implemented for all the staff, including physicians, the principles of coaching are being curious and listening, deep listening, being non-judgmental, and supporting others to be independent in developing their own strategy. So when you think about healthcare, that's a wonderful thing. You can use coaching skills with patients and families. You can use it with your teams, and you can use it with your colleagues. So what we've noticed since we've implemented this form of communication called coaching is that staff or teams are having more respectful conversations, because instead of judging each other or making assumptions or not maybe trusting each other, we're finding that we're having different kinds of conversations that involve asking questions, getting curious, suspending judgment, and believing that each of us both can come up with solutions together. And we're also coaching patients and families. So if I were to enter a patient's room, I might say something like, tell me what you need today. What's most important to you? How can we partner today? And those kind of questions enhance the trust that the patients and families have with the nurses, but also gives them some autonomy in their care. And what we're noticing is that they're taking more initiative in terms of what they need and want, and what's going to help them be successful. So we've given a lot of measure to this. What we've noticed is, as I said, the team communication, it feels more safe, it's more respectful, but also the patients and families are noticing that we're listening more, that they're feeling more safe, but they're also feeling like they can make some of the decisions and choices for themselves.
What type of group goes through this? Is it the preceptors? Is it the educators? Is it the management, or all the nurses? Who's involved with this, and how is that rolled out in regards to the frontline staff?
Mm-hmm. So we make this course available 3 or 4 times a year, and we do little what's called EduQuicks. So what kind of questions would you want to ask your patients today? What kind of questions would you ask each other? Because questions, what they do is, the science behind asking a powerful question is that it ignites the brain, and you start to think about new possibilities that you maybe haven't. So for patients and families, that's a really great thing, because it gets them to a place of critical thinking, and for teams as well. So their brain is ignited. They look at possibilities and opportunities and things that they maybe have done before or not done, and they come up with a solution that's really going to work much better for them than if we had just told them what to do. So we roll it out to physicians and leaders and frontline staff, and we're also thinking about organizing a coaching course for patients and families as well. You asked the model that we're using is it's actually called Coaching Out of the Box, and you can find that online. But the other model of coaching that I would really recommend as a nurse would be the GROW model. Again, you can just Google that, and it's a very user-friendly framework that you can learn to have these really quality, safe, and inspiring conversations with your patients and families. I'll also send you a list of really useful questions that you could use with your team, with your colleagues, with your patients and families, that allow them to, I don't know, just feel more a part of the care, and also for you to gain some really valuable information from them that will enhance the ability for you to care for them when they're in hospital.
Down. And to create a just culture, it really takes what you're talking about in regards to building that safe communication with one another on the front lines.
Yeah.
And interdisciplinary or multidisciplinary, interprofessionally, with between nurses and doctors and the whole healthcare team.
Yeah. And we also know, Heather, that we can't work in isolation. We must have the skills, the competency, and the willingness to have honest, authentic conversations with each other in order to be able to provide the care that we need to our patients and families. So aside from the errors, we know that the outcomes for us as a team, but also for our patients and families, will be so much better if we have the skills to communicate with each other.
So, is there any other project that you can also share?
So another example of a quality initiative that we rolled out recently, well, actually about 2 years ago, we opened a new acute care tech center, which is now the agency that serves the patients and families. So we moved from our tiny old children's hospital to a new center, and we realized for us to be successful and for the patients and families to really feel that the new center served them, that we needed to involve them in the design. We needed to involve them in what they needed to have in place when they came to the hospital to make them feel comfortable and to also be able to meet their needs. So we involved them in the architectural design, the design of the units. We involved the kids, we involved the youth in designing the playrooms, their rooms themselves, what kind of technology they needed, the spacing, the outdoor areas, the light, all parts of the environment. They were involved in designing so that when it came time to build, we knew that we had their voice and their ideas and their best interests in mind. And so what we've noticed now that they've been in the building a couple of years is that it's made such a difference to the quality of care, but also the quality of their patient stay. It's a beautiful space, and I think at the end of the day, that's really what we need to be doing, is listening to their voice, because again, we know that that's going to impact how successful they are, how they do in terms of their visit, but also when they go home. So we've had lots of anecdotal, and we've had lots of focus groups and conversations about how much better this building is, because they've had a opportunity to be involved in the design and the rollout of the care that they receive. So I think that speaks to enhancing quality of the patient experience, is really involving them, because they know what is going to work best for them and their care and their outcomes more than we do. So just listening to patients and families, I think, is a huge part about being able to give quality of patient care.
Talking about is an environment of healing that is geared for children and youth, which looks very different. Can you speak to that? What type of differences are there?
Yeah, well, I think, and this is the part that they informed, was when the kids were at the table, we were asking them, what makes a place child friendly? What makes a place youth friendly? What do you need if you were coming to a waiting room and sitting there? What would be important to you? Everything down to color, to magazines, to the toys that were available. Of course, that's really important for children, to have things to play with. So we focus a lot on play and play as a comfort measure. So the child, if you walked into the new building, instantly you would know it was for children. The artwork, the size of things, the amenities that we support them to be able to access, are all really important for children and families. And families, as we know with children, are a part of our care. We practice family-centered care, and that really means involving the family, engaging them in every part of the child's care, because they know their child best. And for the youth, we really wanted to be able to say, this is a place where we honor what you need right now as a youth health. Youth accessing healthcare can be really challenging because it doesn't really necessarily align with where they're at in their growth and development, most healthcare facilities. So with the youth, we were able to talk to them and ask them, like, what kind of technology do you want to have available to you here? How do we enhance your level of privacy and confidentiality? Because we know that's really important for youth. So we asked them all those questions that we knew that if this was a place that they would want to come to and spend time, because they do spend weeks on end in hospital, what would make it as friendly as a place as possible for them.
Extracting that data that you're talking about, were they focus group interviews? Were they surveys? How did you access?
Groups. Yeah, we did focus groups. We did surveys. We did one-on-one interviews. We walked the building with them, and they pointed to areas that they thought would be a good place for color or artwork. So yeah, I have to say they were involved in every step of the design, because we really wanted it to be a place where they felt that they could make it a second home, because they spend a lot of time in the hospital. So we have, in the ORs, we have digital capacity for the kids to play with. We have simulation of say an MRI test. We have lots of things that for kids that can be really intimidating and scary. We try to help prepare them for those kind of situations, so they know what to expect. They know that they're going to get the distraction and the extra support they need to be able to work through it, so they don't have a traumatic experience.
Khirsty, I'm seeing parallels just in what the students at Western have been learning about community assessment and windshield survey and needs assessment and so forth. And it sounds like just even doing that walking assessment on the grounds, like that environmental survey for the youth, is very similar that what a public health nurse in the community would do as far as a windshield survey or a walking survey, or into looking and observing, as well as partnering with the nursing staff.
Yeah, I think that word partner really resonates for me, and that whatever I do, I'm with patients and families, it's always in partnership. And I think in order to form that partnership is where some of those skills come in around curiosity, around helping them to feel comfortable with you, around building that trust and rapport with our patients and families, in order to be able to have them partner with you. So
what would you share with the new RN BSN nurse regarding the future of nursing?
Yeah, I think I have to say I feel like there's a really bright future for nurses. I think based on my experience that nursing, the actual profession of nursing, has so much to offer. I think I've got back from nursing, my career in nursing, far more than I've ever given. And I think part of that is I feel like nursing is a real privilege and honor, to partner with patients and families, you know, sometimes when they're at their most vulnerable, or they're in a place where they're really feeling uncertain, unsure, you know, a lot of loss, a lot of grief, that I can come alongside them and just be with them and provide any sort of support or care or treatments that they need to work towards health and healing and hope. So I would say that there's a really bright future ahead for new nurses. The world is changing really quickly. I think some of the new, say, for example, technology, I think that's actually going to really enhance our ability to nurse in a more efficient, effective way. I also really, I also really encourage new nurses not to lose sight of the art of nursing, which is really, again, about being present with your patients and families, for whatever that is, whether it's, you know, making them feel physically more comfortable, or listening, or spending an extra couple of minutes with them just to understand better, you know, what is their experience? What has that been like for them? What do they need? In the midst of our fast evolving world, sometimes it's easy to have that get lost. And so I would say the future is innovative and creative and inspiring. There's lots more space for equal partnerships, even within teams. A lot of the way we've provided healthcare is different than it was 30 years ago when I first started. And I've loved to watch the evolution, especially towards how we work together. So bright future, lots of opportunity. Don't lose the art of nursing, of that love and passion that you have for your patients and families. And I'm just so excited. And some days I wish I could start again and do it all over. I'm coming up to the end of my career, so I'm feeling a little bit like I'm going to have to let go of that, you know, that feeling at the end of the day when you have a shift where you're like, yeah, this is what I signed up for. This is really the best career ever. So I wish that for all new nurses entering the profession.
Wow. That's really touched me. I just want to say thank you for all that you've shared, and also thank you when I was there as through my preceptorship at BC Children's and Women's, and the opportunities that I had to conduct preceptor needs assessment and the survey and interviews, that to see the innovation in action. You opened up an opportunity for me to take part of that dynamic sim lab that you have there at BC Children's and Women's. I was a part of the emergency physician residence group that conducted a sim exercise on a children mannequin, and then being a part of the debrief model from the head ER physician, who was just exceptional. And so all that you're sharing, and that piece of innovation, and also the psychosocial, was really, really inspiring for me.
Thank you for inviting me. I always enjoy just even thinking about new nurses starting out in their career. Just how much is ahead of them. The future is endless and full of opportunities. So make sure you all step into that opportunity. Yeah.
Thank you.
Thank you, Heather.